All right, let's dive into a topic that you're going to see everywhere from your nursing exams all the way to your daily clinical practice. We're talking about integrative therapies. And today, we're going to build this really simple mental tool. Let's call it a safety funnel that's going to help you guide patients through all these choices safely every single time.
So, here's how our safety funnel is going to work. We'll start at the very top, the widest part, with some key definitions. Then we're going to narrow our focus down to techniques you can actually lead as a nurse, then to specialist referrals, and finally, we'll get to the most critical point, those life-threatening herb-drug interactions that you absolutely, positively have to know.
You know, this right here, this quote gets to the absolute heart of the problem. So many of our patients think that just because something is natural, it has to be safe. But as we're about to see, that belief can be incredibly dangerous. And you, as the nurse, you are the last line of defense, the safety net.
Okay, let's start at the widest part of our funnel. Seriously, getting these two definitions right is the very first step in assessing patient safety. The big question is this: is your patient adding to their treatment plan, or are they dangerously replacing it?
Let's make this super simple. Complementary means and. So, the patient takes the prescribed blood pressure medicine and they practice meditation. Easy enough, right? But alternative, that means instead of. The patient stops their medicine and only uses herbs. See the massive difference? One might be a helpful addition, the other is a potential disaster just waiting to happen. Now let's plug this into a real-life scenario. Just look at that alternative row. A patient tells you they're using meditation instead of their blood pressure pills. What is your immediate nursing action? Well, it's all about safety. You need to get a blood pressure reading, like right now, and you need to find out why they stopped their meds. This is a classic failure to rescue situation, just sitting there. Okay, next up, let's look at therapies you can teach yourself. Now, the key here isn't just knowing the technique. It's about matching the right technique to the right patient. This is crucial. So first up is active progressive relaxation. It's a very physical process. You're actually instructing the patient to, say, clench their fist really tight, hold that tension, and then release it, helping them feel that clear difference between being tense and being relaxed.
And here is the huge safety point you have to remember. This technique requires energy. For a healthy person who's just feeling anxious, it's perfect. But just imagine asking a patient with end-stage cancer or someone with crippling fatigue to tense all their muscles. It's the absolute wrong choice. It's just going to exhaust them even more. This is a massive exam trap, so watch out for it.
So the safer choice for that fatigued patient is passive relaxation. See, with this, there's no muscle contraction at all. You're simply guiding them to visualize warmth and heaviness flowing through their body. It gets them to the same relaxation response, but without that physical energy cost.
Okay, let's narrow the funnel down some more. Some therapies, like acupuncture, require a trained specialist. Now, your job isn't to perform them, but to act as a safety gatekeeper. You have to know who is not a safe candidate for a referral in the first place.
Just think of this table as your pre-referral checklist. Before you even think about suggesting something like acupuncture, you have to ask, is this patient on warfarin? Do they have a bleeding disorder? If the answer is yes, it's a hard stop. What about electroacupuncture? Does the patient have a pacemaker? That is another absolute contraindication. It's your job to catch these things.
Okay, here we are. We've reached the very bottom of our safety funnel, the sharpest, most critical point. These are the life and death interactions that the NextClex and real life expect you to recognize immediately, every single time.
I need you to memorize these 3 G's: garlic, ginger, and ginkgo. Patients love them, right? They take them for common things like cholesterol, nausea, and memory, but they all share one incredibly dangerous side effect. They all increase the risk of bleeding.
Let's play a quick mental movie in our heads to see why this is so critical. First, just picture warfarin doing its job in the body. Its whole purpose is to make platelets less sticky, right? It's trying to prevent dangerous clots in a patient who has something like atrial fibrillation.
Okay, but now your patient adds ginkgo because they want to help their memory. And what does ginkgo do? The exact same thing as warfarin. It also makes platelets less sticky. So now you have 2 completely different substances doing the exact same job. The patient is essentially getting a double dose of anticoagulation.
And this is the terrifying result. The effects don't just add up, they multiply. They have a synergistic effect. The patient's blood becomes way too thin to clot effectively.
A simple bump could cause a massive bruise, and a tiny little cut could lead to a serious, uncontrolled hemorrhage. This table right here is your high-yield cheat sheet for the absolute worst offenders. You must know these cold. The G-herbs plus warfarin equals a major bleed risk. Valerian plus any CNS depressant like alcohol equals profound sedation. And ephedra in a patient with hypertension, you're looking at dangerously high blood pressure. These are completely non-negotiable.
All right, let's pull everything together. We've moved all the way down through our entire safety funnel. Now it's time to zoom back out and lock in the most important high-yield takeaways for your exams and, more importantly, for your practice.
Let's just boil it all down. 1. Natural does not equal safe. Say it again. 2. Alternative replaces medicine while complementary adds to it. 3. Never ever use active relaxation on a fatigued patient. 4. The G-herbs, garlic, ginger, ginkgo, plus warfarin is a major bleed risk. And 5, and this might be the most important one, you have to ask. Patients often won't tell you they're taking this stuff unless you ask them directly.
Okay, let's put this into practice. Time for a classic NCLEX-style question. You've got a patient on warfarin for AFib, and they tell you they're taking some herbs for memory and cholesterol. What immediately sets off your alarm bells?
Here's exactly how you should connect the dots in your head. The patient says memory, your brain should immediately think ginkgo. They say cholesterol, you should think garlic. Both of those are G-herbs. Both increase bleeding risk. You add that to the warfarin they're already taking, and you have a recipe for a potentially fatal hemorrhage. And that right there is how the safety funnel keeps your patient safe.